people are always talking about the biggest exam struggle is that often multiple answer options seem right. Well, here's the bad news. That is possible. It can be the case that multiple answer options seem right, or at least reasonable. But what could be happening is that people jump to conclusions about what is being asked, and then they focus on which answer option goes with the subject matter best. And as a result, they may be missing the 1 or 2 words that specify what is being asked so that there actually is just one clear correct answer. And here's the good news. Learning to identify these words could be the thing holding you back. And even more good news, I am going to talk about some of these words to watch for and what to look for in the correct option when you see said words. First, that's our first word. First, like what should you do first? First doesn't mean best, like best intervention or first step of an intervention. First means, given only the info in the scenario, what would be the next logical step? First could include things like gathering info, getting consent, assessing, reviewing data, ensuring safety, ruling out medical concerns, identifying function. Well, you get it. Now we have best. Best means best of the available options, not best in all of the land, not even best for the specific treatment described. And it means best given the information in the scenario. Another word is most effective, most appropriate, most socially significant. This means you're going to have to prioritize, not just identify something that feels correct because of its association to the content. Another one is immediately. Now, if you see immediately, think safety, ethics, and preventing harm. Anything that you would consider before you think about long-term progress or effects. Another one is likely. This word asks you to choose the answer that's most consistent with the information that is given, and it means given that given information, you can make an educated assumption, and you don't need to worry about guarantees. Now, this next one gets my students every time. Except. Maybe you can relate. It's a sneaky one. Except means find the only answer that does not belong. And here's the hint. So don't say I never gave you anything. If multiple answers seem correct, then maybe you missed the except. Or some other word that, like except, asks you to choose the one that is not like the others. So the takeaway. If you're struggling to choose a correct answer out of what feels like several strong options, consider going back through the scenario and finding these meaning-changing words. Even better would be a more proactive approach. Before you even dive into the answer options, look for and then highlight those words, and that'll let you know exactly what the question is asking of you. Making those one-word discriminations may be just what the doctor ordered. Or, in this case, the behavior analyst ordered.